Connect and stay ahead with Salam Media. This is Salam Media coming to you live from South Africa.
The time is just gone 8:21 a.m. and we kick off this morning looking at South Africa versus the world and how other countries are implementing the COVID-19 vaccination drive. We've heard earlier in the week the president of the country talking about the rollout in South Africa and initial numbers of 1.5 million vaccines and hoping to roll out over the next few months, right towards the end of the year, talking close on to 40 million vaccines. Now, we know there have been a number of vaccines that have been developed by scientists right across the entire world. And we've also learned that the vaccines that are available right now are 6, and that is against the background of more than 200 COVID-19 vaccines that have been developed worldwide. And to take us through this discussion is we see South Africa trying to get to grips with the pandemic and recording at this point in time the most single-day deaths during the second wave, and also with this new variant. We hear about hospital beds not being ready, and we see this exponential rise in infections and deaths right across the country. The key question here is, where is South Africa in its vaccine rollout plan? We're joined by Aisha Abdool Karim, who is a health reporter at Bhekisisa Centre for Health Journalism. Aisha, assalamu alaikum wa rahmatullahi wa barakatuh and welcome.
Thanks so much for having me on the show.
Aisha, just looking at where we are at this point in time, South Africa versus the rest of the world, and we've seen rollouts taking place in close on to 50 countries at this point in time, and we haven't even started.
Yeah, so I think, we are expecting our first doses to arrive at the end of this month, and that's President Sorum has announced that we have secured 20 million doses with vaccine overall, and so the first million should be coming this month, and then we're expecting a further 500,000 coming in February, and those are the AstraZeneca Oxford University. But essentially, where we are is, the Ministerial Advisory Committee and the Department of Health have been devising a strategy for how we're going to roll out these vaccines, and so that was recently announced. And so we're in the process of preparing the logistics for vaccine rollout, because this is a very big undertaking that we have to do. As you said, we're planning to immunize 40 million people, which is and the adult population, and that's something that we've never had to do before as a country. And so it takes a lot of planning and preparation. And I think, if you look at some of the other countries that did secure vaccines very early on and started rolling them out without really preparing, you can see the kind of problems that you run into there, where it's like, not being able to find enough people to vaccinate, not really controlling how the doses are given out. And so in that sense, you can see how important it is to have a plan in place before you start rolling out a vaccine, so that you don't run into logistical problems or challenges with, following up with people, because a lot of these ask in a few weeks' time to get a second dose. So we're still in the very early stages. We don't have doses yet, but we are in the process of setting up, what's needed to actually deliver a vaccine in a country, and especially something that involves such a complicated process.
Well, Aisha, it's clear that this is going to be one of the largest logistical projects that this country would have embarked upon over the next few months. And it's important for us, obviously, to plan properly to make sure that when these vaccines are administered. They go through a process, a proper process. And the key issue here is we know that Cyril Ramaphosa has been talking about administering this vaccine through various hospitals, clinics, outreach services, mobile clinics. And one of the advantages for rolling out later than many of the countries across the world is it's a learning curve as well, because we can see exactly what has been taking place in other countries, what sort of shortfalls there have been in administering vaccines, so that we can strategize and we can actually plan properly.
Yes, quite right. And I think this whole pandemic, we have been quite lucky as a country in that even when the first wave of infections happened, it hit us a few months off.
Aisha, I think you're breaking up a bit. If you could just possibly move around, we could then get you on a better line.
Okay, I'm sorry. I'm hoping it's clearer now. If it breaks up again, just let me know.
Yes.
But yeah, I think we've all seen that the past year has been uncharted territory. We know that it's been a huge learning curve, and the situation is not much different when it comes to vaccine rollout. And I think also in terms of, as you mentioned earlier, there are new variants of the virus that are now circulating in parts of the world. One of the variants was identified in South Africa and emerged in the Eastern Cape last year, and is now the dominant strain that we have. And there's still a lot of questions about what these variants mean for vaccines. And so in a way, it's good that we haven't begun rolling out vaccines yet, because we still need to find out, how this variant, what this variant means. It means that the vaccines will work against this new type of virus that we have circulating. And in addition, as you mentioned, there's also a lot of lessons that we can take from watching how other countries are rolling out their vaccines and implement that with taking into account also our own local situation and trying to factor that into the process.
Well, on the one hand, obviously there are certain advantages, there are pros, but there are also cons, Aisha. And when one looks at it, the rise in infections and having recorded the highest death rate on a single day, and with the rise in infections continuing again. So, it's actually quite difficult with a lot of unknown quantities that we've come to learn, where we cannot, it puts you in a situation where you're caught between a rock and a hard place, I would say.
Yeah, no, indeed, it's definitely, definitely challenging, and we know that this virus comes with huge consequences, and the death toll is one of those, and unfortunately we have lost a lot of people to this epidemic. And as you know, the point of vaccines is really to help reach a point where enough people are immune to the virus that it stops circulating within the community. And the hope is that if we're aiming to immunize 67% of our population, and the idea is basically that if you immunize enough people, you can protect even that portion that didn't get the vaccine. So, of course, it is important that we do try and get a handle on the epidemic. But as I mentioned, there has been a challenge also in securing doses, because South Africa was unable to buy advanced doses because it was very expensive. And also at that point last year, when a lot of the countries that have vaccines now were buying doses, we didn't yet know when the vaccine would have results, or if these vaccines would even work. And so South Africa opted to not buy a vaccine until they had produced results. So in that sense, we are a bit behind because we have only begun procuring doses, but we have a clear strategy that is hoping to reach the most vulnerable parts of our population. So phase one of our strategy targets frontline healthcare workers, and that includes everyone that is working with COVID-19 patients. It's not just doctors and nurses, it's everyone who's involved in the healthcare setting. And then the second phase targets other essential workers and so the idea is that once you reach those populations, you can hopefully try and prevent severe disease from occurring in the people that would be most susceptible to having more severe symptoms and needing hospitalization. But in terms of also what we're seeing at the moment in South Africa, as I mentioned, we have this it's not that the variant is more severe, but it's just that it spreads much faster. And so because it's spreading so much faster and the country is it's currently in a second wave, we're approaching our second peak of infections, we're seeing than they did during the first wave, simply because the fact is that we do have more results. We think partially, at least, due to this new variant. But then secondly, also because when we started seeing this initial rise of infections, the country was still at level 1 of its lockdown. So people moving around much more freely for interaction. We had a lot more movement. And especially the festive season, people were moving than they were visiting. Whereas during our first wave, we were under much regulations and we weren't able to move around as much. And another benefit, I guess, of what happened during the first wave was that hospitals had been emptied in preparation for the incoming cases because we knew that we were going to see this rise in infections. And so hospitals had been cleared and prepared. Whereas this time around, we weren't ready for the second wave to hit as early as it did. It took everyone by surprise that we were seeing such a massive increase so fast. And the hospitals were not emptied beforehand. And in that sense, as well, that's why we're seeing the beds run out so quickly. Because we were in a way caught off guard and not prepared to handle such a massive influx of cases so fast.
Well, Aisha, let's just wait and see what happens in the next 2 weeks with the rollout. And I'm sure many of us will be following developments very, very closely when these vaccines arrive and when they start getting rolled out initially, as you mentioned, to the group of people that they are meant for. But for now, we thank you for your time. We do appreciate your time with us, and we wish you all the best. Please take care. Assalamu alaikum wa rahmatullah.
Thanks so much.
Aisha Abdool Karim joining us this morning. We come back, we'll be joined by Karabo Ota, Director at the Centre for Child Law, University of Pretoria. We're talking corporal punishment